Welcome back to Chamber Exchange, a TV show. I want to thank our sponsors, Bank Hometown, who helps make Chamber Exchange a TV show happen. I'm pleased to have with us on this segment, Melissa Wenderoth, who is the Director of Early Intervention at our Chamber member organization, Pernet Family Health Service, Inc., which does great work in a variety of ways here in the city. Welcome, Melissa.
Thank you so much for having me. I'm honored.
Well, single biggest issue that we hear from our members on a regular basis, and I talk about it often on the show, is the access to workforce and talent. And that comes in a lot of forms and backgrounds. And clearly, as we've seen during this pandemic, how important early childcare, education, young people at school, and how that impacts the workforce and the workplace and the employers and employees. An element to that is making sure that young people who may have issues that could adversely impact learning and functioning. There's an issue of early intervention, making sure that kids early on are getting the assistance that they need. Maybe you could talk about what early intervention is and children that you work with.
Of course. So early intervention is we provide family-centered developmental services to children who are experiencing or may be at risk to developmental delays. So we go into their homes or daycare centers, and we work with family members to model and support different strategies and tools used to help their children develop and grow. Some of our children that we work with, well, all of our children that we work with rather, are between the ages of birth through the age of 3. So we're working with brand new babies through toddlers.
And people talk about, the data and results that are out there, how things like Head Start make a difference in terms of lifelong learning and success. We know that the difference similarly that full day kindergarten can make. In many ways, early intervention is about working with kids and families to get them ready for kindergarten, ready for Head Start or other childcare settings where that learning process, socialization begins.
Exactly. That's exactly what we do. Besides personal social skills, we work on their communication skills, so expressive and receptive. We work on motor. We work on their gross and fine motor skills. Like I said, we have the personal social, so peer interaction and group play. We work on their cognitive skills, so thinking, reasoning, problem solving, and then adaptive, so their self-help skills such as eating, drinking, and dressing. We really do a full circle of different strategies and areas that we work with these young children.
So if there's someone watching who has a child or grandchild, or if you want to do a screening or early intervention services, are they eligible? How can they learn more about these visits and opportunities, and who's eligible?
So any child between birth through the age of 3 is eligible. It's really simple to get things started. It would just be a very easy referral to Pernet's Early Intervention Department. And how families can do that is they can visit our website, pernetfamilyhealth.org. They can call our agency, which is the number for that is 508-755-1228, or they can actually swing by our office, which is located at 237 Millbury Street. When they visit our website too, they can also learn a lot more about the early intervention programs and all the different programs that Pernet Family Health offers families.
And when these visits happen, are they one particular place or any number of places?
So they're based in the community, the child's natural setting and community setting. So we work primarily in homes or grandparents' home, daycare settings. As the warmer weather we finally have, when it's not raining, we'll go into park settings, anything that's a child's natural habitat to make them feel comfortable.
Got it. And we mentioned from birth to age, the ages again?
Birth through the age of 3. And once they hit age 3, it's not like just everything's done. We about 6 months before their third birthday, we start a transition process where we sit down and we talk with the families. What would they like their next steps to be? In most cases, we are referring the children to the public schools. And so we put a referral into the public schools to get the child evaluated with the different public schools. In most cases, it's Worcester and the surrounding towns. And we support the families through that entire process, where we are giving the public schools any needed information. We are partaking in that transition meeting with the schools. In most cases, we're accompanying the parent and the children to their evaluations. That way, we're a support system to our families, to the children, and also to the public schools to fill in any gaps or answer any questions that the public schools might have in regards to the child services that they've been receiving.
And what you just described really reinforces how important it is that families or individuals who think there may be some type of delay or issue to do these screenings and get engaged with early intervention, because if that process takes place, when that work and those assessments, when you hand off or transition to preschool or early child care, kindergarten, whatever it may be, there's a documented assessment and allows that student and their teachers at the earliest level to kind of hit the ground running, not to have to start all over again.
Exactly. We want to support the child and the family the best way we can, and getting those assessments and evaluations in is a great way for that. Yes.
And just, Melissa, we've just got a moment or two left. And I mentioned when we did the introduction that Pernet Family Health Service provides a range of services that I don't want to put you on the spot. Could maybe just give an overview about Pernet Family Health and all the work that you do beyond just the early intervention work?
I'd love to. We offer many different programs, and some of them come with the early intervention services. We have an emergency assistance program. So we've got our food pantry and our infant supply. So even with our families that are with early intervention, we can bring them food twice a month. We can bring it right to their house during the visits. We have different holiday programs. So at Thanksgiving, we provide a big basket of food for their Thanksgiving meals. At Christmas time, we provide Christmas gifts to all the children 17 and under. And then our other programs at the agency, we have a youth program that does after school homework club, and that's open to any school age child in the area. We have a mentor program for middle schoolers. We have a maternal and child nursing program. And so we have home health aides and nurses that provide home care and support to pregnant and women that are parenting. We have a fathers and family support group, which provides support to fathers in the community with parenting classes, support groups, individual cases, case management. And then we also have a parent aid program, which provides families that are working with the Department of Children and Families different support. So whether that's household management, parenting skills, or just help accessing different community resources within Worcester and the surrounding areas. Pernet Family Health really likes to support the family in lots of different aspects. And if we're not able to do it within our agency, then we find the different community resources that are available to help them.
Yeah, well, a lot of important services, and certainly an anchor in the Green Island, Vernon Hill neighborhoods as well. So Melissa Wenderoth is the Director of Early Intervention at Pernet Family Health Service. Thanks for being with us in this segment of Chamber Exchange, a TV show.
Thank you so much for having me. It was a pleasure.
And to our viewers, hold on. We've got one final segment. We're going to talk a little about the new Worcester Green Corps and the impact they're having already with a start recently. Stay with us.
Since 1889, Bank Hometown has stepped up to bat for our neighbors. In the past 5 years, we've donated $1.3 million to local organizations that help enrich lives and bring people together. And we're not stopping there. We're always looking to tackle the challenges of today and fuel the leaders of tomorrow. No matter how life changes over the years, we'll continue to show up for our neighbors, for our communities, and for you. Bank Hometown. Unlock your potential.
This is Radio Worcester. Local talk, local news, local events. We got it, and we've got opinions that you're going to want to hear.
That Worcester will be thought of and spoken about.
We're live every morning, 6 to 10 a.m., and if you can't catch us then, you can find us online day and night at radioworcester.com. This is your town. This is your morning show. Talk of the Commonwealth with Hank and Ben.
Just watch me now. Just watch me. Just watch me now. Just watch me. Just watch me now. Just watch me. Just watch me now. It's so good.